2 on Your Side's Jeff Preval is taking a look at the changes hospitals there are making to deal with the surge in patients.
It's very concerning. We've, over the past few weeks, have seen that steady increase, both in the community presence as well as at the hospital levels.
COVID hospitalizations have been surging in the Finger Lakes in recent weeks. The state's regional dashboard on hospitalizations says just 2 days ago, 945 people were hospitalized with COVID-19, more than 4 times higher than the region's peak in the spring.
Are the hospitals overwhelmed, would you say?
They're very tight. Yeah, I struggle with the word overwhelmed, Jeff, just because I think our healthcare systems and as a whole, no matter where you are very dynamic.
Rochester Regional says it's using numerous strategies to boost capacity, adding more beds, adding COVID pod units, and at United Memorial Medical Center in Batavia, a medical floor has been turned into a COVID unit. Still, Rochester Regional's average length of stay for COVID patients is increasing from 3 days to 5 to 7 days.
So that creates the volume that you're hearing and seeing about in hospitals. Is when you can turn them out and get people back home in 3 days, your beds open up quicker.
He says many steps are being taken to help out frontline workers, pulling in clinic nurses, bringing back retirees, and bringing in student nurses. All this as hospitals prep for New Year's Eve.
We've been actually working on those plans for the last 2 weeks to be able to have some additional staffing in-house should we get an influx.
And of course, New Year's Eve, a very busy time for hospitals, but with public celebrations being canceled this year, hospital officials hope that reduces overall hospital admissions. In Niagara Falls, I'm Jeff Preval, Channel 2 News.